you so much for joining us for our Clinical and Translational Science Seminar Series. Today's topic is community engagement across Penn State University, focusing on the landscape and resources to support community and academic partnerships. And I am absolutely delighted to introduce some of our speakers, and then some will be introduced to you as we continue through. First is Ms. Miriam Miller, who joined our College of Medicine as our Community Engagement Coordinator for our CTSI Community Engaged Research Corps in 2022, so just this year. With a heart for rural Pennsylvanians, Miriam helps facilitate community participation in research by fostering relationships for research collaborations between community members, health providers, policymakers, and academic researchers. We're so thrilled to have you on our team, Miriam. I'd also like to introduce you to Andrea Murray, who is project manager in the Department of Medicine at Penn State College of Medicine. Andrea joined the college in 2018 and has outstanding expertise in rural health, racial and ethnic minority health, and the social determinants of health. In her role as Director of Community Engagement for our CHEER program, Andrea extends her leadership to identify and strengthen community and academic partnerships across Pennsylvania. And last, but certainly not least, Ms. Jennifer Poger, who has been part of our College of Medicine research spanning multiple disciplines, including neurology, pediatrics, public health sciences, and of course, Department of Medicine since 2005. As Director of Education for our CHEER program, Jennifer develops, facilitates, and evaluates educational opportunities to promote community academic partnerships and enhance skills necessary to thrive in community engaged research efforts. With that, I'm so thrilled to have this outstanding team lead you in a really outstanding discussion today. And we will have time for question and answers at the end, as well as I'm sure they'd be okay to answer those if they come up as they go. Please do use the raise your hand feature if you do have a question. Thanks, team. Take it away.
Thank you so much, Dr. Krasniewski. Welcome, everyone. Really thrilled that you're able to join us for this seminar to learn a little bit about community engagement across Penn State. We're going to look around the landscape and resources to support community academic partnerships and some exciting things that we have underway to further provide resources to our teams here at Penn State that are engaging the community. So just briefly for the agenda, we're going to talk about why we do this, why this approach is meaningful and important to further and advance research in science. We're also going to learn about specific resources here at Penn State through our CERC, the Community Engaged Research Corps, through the Penn State CTSI. And we'll get to hear from a researcher that was able to utilize some of the CERC resources to further her work, along with a community partner spotlight. So excited for that piece especially. And then I can share a little bit about the Community Health Equity and Engagement Initiative, which is a new initiative that we're starting here to really supplement what CERC offers to promote and provide sustainability for these partnerships between academia and the outside community. So first, why engage community partners? Well, it turns out, no surprise, that translational health research really isn't set up very effectively. It's slow, it's quite costly, and there's lots of silos. So we have researchers or clinicians kind of working in different pockets. But really the question is, where does the community fit in with what some of those goals are to improve health outcomes for patients? And it seems like research is really being conducted on them rather than with them. And so what we've seen really over the past few decades is this paradigm shift where research is now conducted. It's sort of a different approach to look at research, where instead of working in those silos, we can actually expand our multidisciplinary team to include non-traditional research partners. So when we're saying the terms community or stakeholder, this can mean a variety of folks of people. So whether it's professionals from the school setting, the departments of health, so folks that are part of policy or government agencies, different community-based organizations, parents, caregivers, patients themselves. There's really no exclusion in terms of who we might invite to the table that could have a vested interest in the research and really help advance it. And so why do we do this? What's the benefits of this? There's several actually, and it's really a growing body of evidence that supports the benefits of engaging non-traditional partners throughout research. One, it can help make sure that we're actually studying and answering questions that are relevant and meaningful to the population in which we're hoping to serve. So by partnering with the community and having those conversations really early, even before the research begins, we get to have an intimate understanding of what their true needs are, things that we might not know inside the walls of an academic building or a clinic setting. It can also really help improve recruitment and retention. This is something that Penn State, as well as many other organizations nationally, really want to strive to improve upon in terms of recruitment into clinical trials and other types of research studies, and also retaining those participants so that they're able to get through the entire study, but then also that they want to come back and they want to participate in other ways, and whether that's through research or other types of engagement that we can offer to them. And it turns out that by forming those relationships early with the community, it really just has a beautiful cascading effect to lead to that, where they are willing to want to come back and want to learn more about the exciting things that we have to offer them, both through research and other opportunities as well. It also increases translation. So we know that when we, as researchers, do research and we want to get that information out, we attend conferences, we present, we publish in manuscripts, but that's not always getting into the hands of the community in which really help make the research possible. And so we can leverage the community connections that we have through community engaged research approaches to really help translate those findings so that they're not just sitting in these scientific journals, they're really getting into the hands of those who can make the decisions to improve the lives of different populations, or to have the patients themselves make more informed decisions about their care that they receive. And lastly, funders are really elevating the importance of engagement. So while community-based participatory approaches have been around for several years, really dating back into the 1980s and even prior to that, there's some documented studies. Funders really picked up on this, I'd say, within the past 10 to 15 years, really formalizing this process for engagement and striving to grow the science of engagement to better understand the best way to engage with these non-traditional stakeholders and partners in order to make meaningful impacts to the research and then the translation of that research. So funders like the NIH, the Patient-Centered Outcomes Research Institute, along with the CDC, all have some components of engagement that are priorities for them and for the research that they fund. So we're seeing a lot more interest in this across the federal agencies. Even some of our funders that we wouldn't think are really starting to come on board as well, like the National Science Foundation. So when we think of faculty and research teams that apply for different funding mechanisms, it's not always just our public health researchers. Now we're seeing folks across the whole research spectrum that can really benefit from the community engagement to refine their research aims and objectives and really make their research more impactful. So community engaged research really does fall on a continuum. It's a linear model, and as we move further down this spectrum, it's really symbolic of the continued partnership that can come from engaging with the community and where that can lead to. So most of our studies here at Penn State probably fall somewhere between the consult to participate phases, where we have a lot of engagement with stakeholders to help guide the research, but it might still be investigator-led in terms of what the research question is and how we carry out some of the methodology. But we're refining that by consulting or even having some of our wonderful community stakeholders participate in different phases of the research. But what we're hoping to go through is into this direction that if we continue to have these wonderful interactions and these partnerships that we're able to sustain beyond the life of a single project, we can really work together to have the community feel empowered to start initiating research on their own and really feeling like Penn State's a place to be where they want a partner to do that. When we look at the other end of the spectrum, it's really much more of a top-down approach, and we know that is not the best way to decrease that translation time to get what we learn from research out into the hands of those that can actually utilize it to make better decisions. So going in this direction really leads to wonderful things. So when we take that conceptual model, how do we actually operationalize this? And and put it to good use to engage our community in our research. We encourage teams to do this as early as possible, even before we can develop that research question or think through what that proposal will look like to a funding agency. It will look really good if you've already forged some of those relationships in the community to identify how those experts in their respective fields, or even if it's a patient with lived experience, how that can really be impactful to not only your proposal, but how you'll carry out the research. Certainly, once you start your study, inviting those partners to continue to share their expertise to enhance that study design and what those outcomes look like is very meaningful as well. In terms of data collection and analysis, we've had several stakeholders participate in those key phases of the research, whether they're helping with recruitment or informed consent and study procedures, or if they're helping us analyze the data to make sense of it from a clinical perspective and compare, maybe what they're seeing in a clinic setting if we have some clinician stakeholders on board. Also, some policymakers you might engage during this phase to help, understand how maybe policy needs to be adjusted to match what we're seeing from our research findings. So lots of ways to engage throughout some of these basic cores of the research life cycle. Results dissemination and translation really hits home for me. I feel like this is a really big space here for lots of opportunity to engage the community in this piece, getting the word out in vehicles of dissemination that will that the community will be able to find out about easily and that works best for them. So really thinking through lay dissemination mechanisms that can really help translate those results to those broader audiences so that they can then continue to spread the word and care more about the research that we're doing and want to participate in the future. And then this last phase really is what will set off the cycle again. So this impact and call to action. How can we, understand how this process went and what we learned about it so that we can refine those steps for the next phase of that research or for continued partnership as well. So when we think about the landscape of community engaged research across Penn State, I just want to show you over a 4-year time frame how significantly the community engaged research projects has grown across Penn State, not only by the breadth of counties that we've reached, but also the number of projects that we're supporting that have a community engagement component. So this is mirroring the national trends that we're seeing in terms of support and resources to really make this type of partnership possible. Again, it's not a study design, it's actually just an approach to research that can be leveraged in all research designs and really just takes into consideration what the community values and what the community cares about and the different intricacies of a community to help us understand how to carry out that research a little bit more meaningfully so that we can help those populations. I'm going to pass it now to Miriam, and she's going to walk us through a little bit of the resources that are offered through the Community Engaged Research Corps that really have had a profound impact on a lot of the faculty research that has been supported through some of these projects that she'll talk about here today.
Thanks, Jen. So I'm going to give you a little bit about some of the goals of our Community Engaged Research Corps. So our goals is kind of to be that bridge and to help that bidirectional communication that Jen mentioned. And so we're going to assist with engaging and partnering with our community members and our research teams. We're looking to build relationships and partnerships. And we want to support communities' involvement and their role in that, and that they are heard and valued in research. And we'll also help to develop some community health coalitions. So our goal is to be the bridge and to create opportunities to bring both researchers and the community together. The seeds we plant kind of help these symbiotic relationships grow as the research grows as well. Next slide, please. So these are some of the tools that we can offer for researchers who are interested in finding a little bit more about community engaged research or getting more involved. So there's consultations. So and that can be a wide range. It can be everything from research planning and recruitment and retention. It can be working as a team in our health policy group. And we provide letters of support for grant proposals. and applications. And we also have connections with our community partners. We've been doing this for a number of years. Andrea and Jen and the crew have a whole group of great relationships already started over time. And so if there is something that you're interested in or wondering what a community is thinking about, we probably have the ability to make that connection for you. There's also a community engaged research toolkit, which Jen will be discussing a little bit later today. And then the next one I want to talk about briefly is the community engagement studios. And that's just an opportunity for researchers to get community input, to find out if what they're researching or the questions they're asking on their research is most relevant to them. One of the examples that we use, and maybe I'm going to take Andrea's example, is that, you know, you could have a researcher who's wanting to study obesity and like, hey, I'm going to go into Reading, or I'm going to go into Harrisburg, or I'm going to go into these cities and say, I want to study obesity. There's a childhood obesity problem there. And these community members are really like, no, like, well, they don't see that they have a childhood obesity problem. They have a problem finding fresh fruits and vegetables, and they're in a food desert. They have to go a mile to find a grocery store that's not a convenience store. So these are opportunities for us to kind of find from the community what it's really like out there, because our world is not their world necessarily. The next thing we do is that community driven research day. We're working on that for spring of 23. And this is exactly what it's about. It's kind of taking that spectrum that Jen shared and pulling it to the right. It's letting the community kind of help drive the research, finding out from our community leaders what's going on in your community. Our research day for spring of 2023 will be in rural Dauphin County, in northern Dauphin County. And we're starting to work with community members there to learn more about their community, what's important to them, and, you know, how research could help them address some of their needs and concerns. And hopefully, you know, making that relationship is something that, you know, will continue to drive the research and the relationship between the community moving forward. The next slide, sorry. The next area I wanted to hit on real quick, as far as services that CERC offers, is our Community Engaged Research Fellowship Program. The applications were originally due on October 1st. They've been extended to October 24th. And it provides training and mentorships to scientists interested in advancing their community engaged research expertise. So this could be anything from a junior researcher or a new researcher to maybe someone who's a little more experienced but doesn't have a whole lot of community engagement experience and is looking to develop that more in their work. The fellows become part of our CERC team. They can attend meetings. They work with the CERC activities and consultations to kind of have a better understanding of how community engagement works in research and how to buffer their research with it. And the fellowship provides some salary support to the fellow, as well as financial support for the mentor as well. So if you know of someone or if you yourself are interested, please feel free to contact us. The information is also on the CERC website as well, on the CTSI website. Next slide. So this is just a little snapshot of some of the things that we've been doing in the last it was a 15-month window from when we had presented at our directors' councils. And this, of course, most of this is during COVID, or when COVID was more COVID. And so we had 27 consultations, 4 letters of support. We conducted 9 community engagement studios, and we have 5 funding successes and potentially 2 more. Next slide. So this is just kind of a snapshot of those projects that were funded, the CERC support that those researchers sought out and were able to utilize, as well as the funding, the funding source that they were able to get money from for their research. So a couple of these, well, at least one of these will be spotlighting in a little bit. But in the meantime, I'm going to pass it over to Andrea, and she's going to give you a little more insight into community engagement studios and how important they are in this process.
Great, thanks, Miriam. So I'm so excited to talk with everybody about community engagement studios. I think one of the best tools that the CERC provides to our faculty and staff here at Penn State University. You can see here the wide list of community engagement studios that happened in that same time period that Miriam was describing for us before over the past 15 months. Of note, all of these community engagement studios actually happened via Zoom, or having our community partners join us over the internet instead of being in person. Prior to COVID, we would gather at community organizations, locations, libraries, city halls to gather community participants together to sit down and talk about the research that's going on at Penn State and what is happening out in their communities. But, the pandemic changed the way things had to be done. And we knew that something that we wanted to do was keep a pulse on our communities and also continue the great research that happens here at Penn State and including our community members in that. And so over those past months, we gathered faculty members that just needed a little bit more input to the research that they were doing, whether it was they were getting ready to submit for a grant, or they were answering questions from grant reviewers. This opportunity to have a community engagement studio provides insight from the community members and really makes the research that faculty are doing here at Penn State that much stronger. A lot of these folks have received funding sheerly because they received the input from their community partners. And so we have the opportunity to provide these to our faculty here at Penn State through the Clinical and Translational Science Institute. Miriam and I work together to bring these community engagement studios to light. Our jobs are to hear what our faculty are researching and the questions that they might have about their research. Also identify community partners or community members that would be a great fit to answer those questions that they may have, and then bring them together in a space for a really great conversation. So community engagement studios are typically a one-time 90-minute meeting where community members give feedback and advice to improve upon the investigator's research. So if you're thinking about, should I do this research via survey, or should I have the research participants give interviews with us? How does the community feel about having their blood drawn 6 times for a clinical trial? Do we need to kind of think about how many times they can come in and visit our clinical research center? And so it brings insight to the research that's really happening here, and then helping our faculty think about what the proposal looks like, and really helping also with recruitment and retention as well. It's really cost effective. Community engagement studios provide our faculty a great opportunity to connect at a really low cost. So these studios are really free to our faculty that are looking to engage in them. Staff time, like myself and Miriam, is paid through the CTSI. We look for our faculty just to provide stipends to those that are being a part of those community engagement studios. And that all can be handled with your financial folks in your different departments as well. They're efficient, and it's a great method to engage participants and stakeholders and to enhance current research practices and improve upon dissemination as well. So on the back end of your research, community engagement studios can be used to figure out, how do I get this information that I just obtained through this great research I did out into the community for them to know what's happening behind the 4 walls of Penn State University. Community engagement studios don't require IRB approval. These engagement studios are surely to help drive the research that's being done here at Penn State. Research information isn't gathered during these, but really just to formulate what your research looks like and how the community engages with that research. And we also like to think it's one of the best methods to inform the development, conduct, and dissemination of research. patients get to know about these studies from the get-go. And if you notice, when people go out into the community, maybe at a restaurant or maybe getting their hair cut, they take part in a community engagement studio, and then they might turn to somebody beside them and say, hey, guess what I did today? I got to sit down and talk with this researcher that's looking at how we can genetically modify genes in our bodies that there might not be autism anymore. And so it gets our community talking about what's happening here at Penn State and gets them a little bit more involved in the research and how our research affects their everyday lives. So I have the privilege to introduce Dr. Kristin Sznajder. She's an assistant professor of public health sciences and associate director of internal initiatives at the Penn State College of Medicine. Kristin research centers on social and environmental determinants of health along with vulnerable populations, with a focus on women of reproductive age. Her current projects are on COVID-19 and maternal and child health in Pennsylvania and HIV and migrant youth in Ghana. We also have with her today our wonderful community partner, Sarah Kafferlin. Sarah took part in our community engagement studios and that we conducted with Dr. Sznajder. And we're so happy to have her here because we wanted to give everybody on the call a little bit of a feel of what it looked like for involvement in these community engagement studios from the perspective of a faculty member here at Penn State and also a community partner. So I'll go ahead and hand it on over to Dr. Sznajder.
Thanks, Andrea. Yes, I'm so thrilled to be here today to talk about what a great opportunity it was for our project to be partnered with CTSI and to conduct a community engagement studio. And also, so Sarah and I are going to talk a little bit about this. I'm planning to kind of explain like why I went to CTSI and why we decided to use this community engagement studio. And then next, kind of the things we learned. And then we'll talk a little bit with Sarah too about her experience. So the reason I really wanted to come to CTSI and get involved with the community engagement studio is because we're anticipating some challenges in survey research. We want to make sure, so sorry, this is kind of an action buttons. You can just go through all of it. Thanks, sorry about that. So the things we wanted to check were participant motivations. This is sort of what was talked about earlier. What makes participants want to engage in the research and then ultimately be recruited and enrolled and retained in our study. And our study design is longitudinal. So we're really interested in why people might want to be a part of this research. And some of the things we were able, so our research, just to back up, and I think Andrea kind of mentioned, but it's on COVID-19, the COVID-19 pandemic, and pregnancy and postpartum health and child's health. So we're following pregnant women through 12 months postpartum. So some of the things that we wanted to ask is, how do people view the pandemic nowadays with everything changing, and what are some of their concerns? So we certainly were interested in learning what are things that the community members, our target population for the research, are thinking about related to our research topic. We also wanted to understand their understanding of our research and how we could better communicate what we're planning to study to the public. So maybe that would help them be more interested in what we're doing. We were also fortunate to go, I mean, I think you saw on the earlier slide, we actually had 3 community engagement studios. So I mean, I just love them, and we're planning to do more. So, but we were able to go through our kind of long survey. And like I said, we have 4 survey time points. So we were able to go through all the questions with our community members to make sure they understood what we were asking, and to make sure that it made sense to them and it would make sense with their own experiences, which helped us a lot when our survey design. And then just to understand their experience overall, going over kind of what we were planning to do, our research questions, our consent, our survey, and how they would feel about participating. Something that was so wonderful about partnering with CTSI in this is that we could capture, they have a wide reach. So we were able to get diverse perspectives into our community engagement studio, which would have been very difficult without working with CTSI to do. Also, they're just really lovely to work with and just fantastic. They have group facilitators that help, and they stay on the line, and they ensure that the conversation moves forward and everyone's heard. And so it was a fantastic experience. Okay, next slide, please. So the things that I just want to talk about, some of the things that came out of this for me that really helped our research. One, we went through the consent document, and there were some areas that may have been confusing or they wanted further explanation. So that was fantastic feedback. I was able to edit the consent to make it more appropriate for participants, so that hopefully that would be something everyone would understand and feel comfortable with. Again, we went through all the questions, so some of them were kind of tricky to answer, maybe the way that we had phrased them, or that we needed additional response options that we hadn't thought of earlier, and wordings to questions. Some of the things too that came out, I know there were a few instances of this, but what participants may want to know through the research. So somebody had mentioned about fertility treatments, and we hadn't actually had that question initially, but certainly that should be important, and we added it to our survey. And then just unique patient participant experiences that could be important to include in the survey. So that's kind of what I meant. So that was one example, but there were quite a number. But overall, it was just a wonderful experience. Each session, we had 3, each was about 90 minutes. And we were able to engage people. We were able to, through CTSI, we were able to reach out to a bunch of people who were either pregnant or postpartum. So I know that Sarah's here, and she was at all 3 of our meetings, and she was very engaged and just wonderful to work with. So I don't know, Sarah, if do you have anything to add? I just want to give you a chance.
Sure, yes. Just the experience overall was really positive for me. A stay-at-home mom. I was a teacher prior to that. I have a 1.5-year-old daughter, and then one due here in the next month or so. So it's a really a great experience for me. Like Kristin said, it was the 3 sessions all together. It was kind of interesting to have that back and forth discussion. I know maybe initially because of COVID, Zoom was maybe viewed as a negative, but I thought that was a really great way to do this, especially with little people at home, that made it possible for me to participate, during a nap time or whatnot. And just being a former teacher, I really appreciated the academic conversation of it. I had done one study before when my daughter was due through Penn State about sleep and parenting, had a good experience there. So it was definitely something I was willing and interested to come back for. I think I had seen the ad maybe on Facebook or something like that is how I found it, but then it was to email in to see if you were qualified to participate. So it's definitely something I would do again. You had talked about funding and different things. It is a benefit to have that available to participants just to make it a little bit more like worth your while. I know we had made plans with the first study we did, like to add to my daughter's 529. So just as just a little extra benefit, to community members, but also COVID obviously affects everyone. So it was interesting conversation, and I'd definitely do it again. It was a positive experience.
Thank you so much. Yeah, it was for me too, very positive.
Well, thank you both so much, Dr. Sznajder and Sarah. We really appreciate you sharing how you were able to utilize one of the Penn State resources to support your community engagement. And it's really a wonderful example of the mutual partnership that you had, where you were both able to come together, come to the table, and share your perspectives and help strengthen research and really learn from each other. So I think that whole bidirectional learning and communication is very valuable to advance research and also help improve a patient's situation. So thank you both for attending and presenting on that. We're just going to close our session by just learning a little bit more about this Community Health Equity and Engagement Research Initiative that is still in its infancy stages. This is a partnership through the Penn State CTSI and also the Penn State Social Science Research Institute. So we're hitting the ground running. We've been working over the past year really on building the foundation for how this initiative can really supplement and provide ongoing support to research teams So really, CERC helps kind of get things off the ground, and then we kind of can help follow those teams and provide support along the way to maintain those partnerships between academic and community, and also provide further opportunities for continued partnership. So some of our key goals here really are to broaden this capture and develop repositories of where these researchers exist and where community members are actively engaged or interested in community engaged research. So those heat maps we looked at in a few slides previously really were from data that we gathered through a survey that we sent out to both faculty members as well as community partners and even community health workers, who are a really valuable stakeholder group that we have tapped into, and they've been really, really impactful on advancing research through their help with recruitment and retention. So that's a particular focus that we're very interested in, and seeing how we can advance that to help address some recruitment issues that we're having at Penn State. But that survey data really helped illuminate where these partnerships exist right now, and then where there's opportunities for further collaboration. And so that can really help facilitate that matchmaking that we hope to continue to do, and support CERC in their efforts to match researchers with appropriate partners to advance their research goals. A unique piece of CHEER is also to provide educational onboarding and resources, both for faculty as well as community partners. So we just recently launched our very first community-facing workshop. We had almost 100 in attendance at our community event, and it was on grant writing. So there was a lot of interest that we learned from our survey data on grant writing, and it was a wonderful success to have our community partners be able to learn from other community-based organizations, as well as researchers who have partnered with the community on research proposals. So we hope to continue to provide educational onboarding that meets the needs of both researchers and their community partners as well. And then, as I mentioned, creating pathways for sustaining engaged partners, so that when the research study ends, it doesn't mean the partnership has to end, because when you get to that point, you've developed such a wonderful rapport, and you have a really well-decorated team of individuals from various backgrounds that now know how to work together. So we want to keep those good conversations going. So, we're looking for pathways to continue to sustain those partnerships. So just over the past year, our footprint is expanding to include some of those educational presentations. We've also had several consults with both researchers and community partners. So we've worked with some community members who have a research idea or are interested in partnering with a specific specialist or faculty member in a particular research area. So we've been happy to see some of those partnerships forged through our assistance. We also have a wonderful team who has attended several community networking events just to kind of get a pulse, as Andrea had mentioned, on what's going on out in the community, what the community needs are, so we can help bring back those research priorities to our research teams here at Penn State. And we've also been trying to keep up with the latest and greatest in community engagement. So we've tried to attend as many conferences and webinars and other educational opportunities as we can up until this point, to help build the foundation for CHEER. In addition to collaboration meetings. So just meeting with lots of other wonderful teams here at Penn State to find opportunities for synergy between the work that we're doing and the wonderful work that our other support offices are doing as well. As Miriam mentioned, we are working on community engagement toolkits that we hope to launch soon. They're just under the design phases at this stage, but we will have both a researcher and community partner facing toolkit that will really cover the very, very detailed pieces of community engagement. So the goal with this toolkit was really to provide an expansive resource. So not necessarily to be read cover to cover, because they are quite lengthy, but really to serve as a how do I actually do this here at Penn State guide. And this is evidence-based. So we really did our due diligence in making sure that we researched how other CTSAs are approaching engagement, and what some of these best strategies are that we've incorporated into our toolkits to help give the best advice. And then we've also found out through a lot of those collaboration meetings, what are these other support resources and offices that can help facilitate this type of work here at Penn State. So stay tuned for those. We hope to also have some type of a website where they will live that can be accessed very easily for both our researchers and our community partners. Another thing that we've done over the past year that we're very excited about is we've worked in partnership with the Human Research Protection Program here at Penn State to identify and adopt a lay research ethics training alternative for community partners. So when we have community partners that are engaged in research in terms of actually conducting informed consent processes or any data collection, if they're true study team members, they have to complete some type of research ethics training in the same way that all of us do as researchers. But we didn't feel that the city training that we do is necessarily appropriate for a lay audience. And a lot of our community members come from various backgrounds, various demographics, and we felt that that training wasn't specifically addressing their unique learner needs. So we were able to work in partnership with our IRB here and our HRPP program to really identify one that has been a benchmark and has been utilized across several organizations over the last several years. And it's known as certification, but we call it CERTI Online for short and sweet. And this is really a wonderful program that really puts the training through the lens of the community partner and provides that foundational knowledge about research ethics, research atrocities that have occurred in the past that we now have all of these wonderful regulations and oversight in place to avoid in the future, but also touches on topics that the community partner will likely come across in their role as a member of the research team. So through case studies, lots of interactivity, even though it's an online asynchronous program, it really does a very wonderful job of making sure that the community partner can learn the foundations of some of these different principles, but also be able to relate it to their particular role on the research study. So any team that has a question about this or is maybe interested in pursuing this for their community partners, please reach out to our cheer team. We're happy to help give guidance on who might this be most appropriate for in terms of your community partners and the level of involvement that they'll have on your research. And then just for future programming, as I mentioned, we have been kicking off our educational webinars that we've been holding. And so our next one coming up is at the end of next month. And this is an introduction to community engaged research, the what, why, and how to get involved. This would be a community facing one, but we welcome anyone who's interested in taking a little bit of a deeper dive than we were able to get to today. But also please do disseminate if you're able to with your different community partners or other colleagues that you might have that have connections in the community. We would love to have a robust attendance to continue the conversation and make folks aware that we're doing great things here at Penn State, but we can only do it together with the involvement of the community. And then we hope to also have a December workshop on overcoming barriers in community academic partnerships. This was something from both of our survey data, both on the community end and that researcher end, that was an area of interest that we hope to explore. So tying in this concept of team science and really expanding that to how team science works in some of these non-traditional partnerships. So there's lots of evidence to support how we can work and function together in multidisciplinary teams. But how do we do that then when we expand that even further with other community members as well? So lots of things to explore in there, and we hope that you can join us for that. So we'll keep everyone posted on when that registration comes out. I just wanted to take a moment to introduce our fabulous team. So Andrea Murray is our Director of Community Engagement for the cheer, and Paula Moody and Jess Schrodel are fantastic project managers. So if you do engage with cheer at all, you'll see their faces. They're at several community events, and they also help with a lot of the consults that we've been doing as well. So a wonderful group, and it's been exciting to get this off the ground, and we look forward to what's to come. And now we'll take any questions or feedback you might have. Thank you.
Well, thank you so much to our wonderful presenters today. That was a great presentation and whirlwind overview of all things community engagement that Penn State University and our CTSI have to offer. So please don't hesitate to ask these experts questions. You can go ahead and unmute. I noticed we don't have a chat room, but feel free to use your voice.
Hey, Jen, this is Dee. I just wanted to say, I thought that was a great overview of what CERC is doing and, what they have to offer, and as well as the other community engaged projects around College of Medicine. Well done.
Thank you, Dee. We take compliments too, so.
If one wants to become involved as a community partner, is there a point of contact? Is there someone to contact if one wants to become a community partner?
So we have information on the CTSI's website that is community facing, and there they would contact our engage at pennstatehealth.psu.edu email address if they're interested. Also, as you heard Jen Poger say, our project managers, Jeff Schrodel and Paula Moody, myself, Miriam, we're out in the community all the time as we're going to different events and meeting with different groups of people. And so when we're out at these events and community gatherings, we tend to take our form with us as we meet new people and start engaging to ask them if we can save their information to be a part of our community here through the CTSI and be partners with us. And so they can definitely contact through the CTSI's website or see us out in the community as well.
I had a question about the workshop sessions and how you participate / sign up for the, I guess maybe they were called feedback sections. I was interested in the engineering one.
Oh yeah, sure. So our we'll have some registration out we'll do a follow-up email that can be involved. But if you're talking about the community engagement studios, okay, there you go. Okay, perfect. So those community engagement studios. So if you're interested in setting up a community engagement studio, you can contact Miriam Miller directly through her email address, or you can contact engage at pennstatehealth.psu.edu. And so we check that email frequently, and we'll get back in contact with those folks that ask for a consultation or a community engagement studio, and we'll start making some plans.
I have a follow-up question.
Sure.
Because when you were talking about, sorry, I accidentally first world problems. With the community engagement studios, you made it sound like only people that were ready to pitch something should attend. But what if you're before that stage? Like, I kind of want to watch the entire process so I know and have a better understanding of what it is.
Sure. Yeah. So we actually have some community engagement studios coming up here that are with the Department of Engineering and one of the faculty there. And so we can ask if it's okay for you to join in and see what those are like. But we can also provide you with some overviews of past ones that have been done. So we usually create some PowerPoint slides and have documentation of questions that faculty have asked previously during those community engagement studios as well. And so we can guide you through, figuring out if it's the best mechanism for you as you look forward to research. They're definitely a good opportunity to just even talk to community partners about thoughts that you might have before even a request for application comes about for that research.
Thank you so much for sharing all this information with us today. I had a question regarding the eligibility of grad students to pursue these services. It seems like a lot of the opportunities are tailored towards faculty or community members. And I was just curious what routes grad students should go to if they're interested in learning more and getting involved.
Great question. And so I'm sorry, I say faculty a lot, but these can be utilized by anybody here through the Penn State College of Medicine and Penn State University, including students. And so what we would have to talk about a little bit is just funding and funding mechanisms for those community partners, but we always can find ways to make things happen and to support anybody that's moving forward in their research and research processes, including those that are right at the beginning. And so why it might not be a community engagement studio, we have other options too that we can help support you in including community more in the work that you do. So yes, not disclusionary of our students as well.
Thank you so much for explaining that.
Sure.
Any other questions or comments? I'm going to pull up a final slide, but I won't make everyone dizzy spinning through it. So just give me a moment to get that up for you.
Well, while Jen is doing that, I do want to thank you all for joining today's session, and please do reach out to that email address. Apologies for not having a chat this time. We'll figure that out for next time. Zoom is always teaching us something. Oh yes, thank you, Jen. So wow, right on cue, you get to support me in announcing next month's seminar. So October, we will be talking about strategic planning for every team. So this includes community engaged teams. So I do hope you all will take the chance to join us next month. Thank you for attending today. We'll follow up in the next week with some follow-up contact information and slides. Have a great day.
Thank you so much. Have a good day.